There's a doctor in Japan who just turned 105 years old, still sees patients every day, and attributes part of his longevity to a simple 15-second ear massage he's done every morning for decades. What he discovered about stroke prevention might surprise you. Welcome to Prime Health Lab. I'm here to help you understand your body better so you can live stronger, sharper, and healthier as you age. Today, we're diving into something fascinating: how a quick technique involving your ears might actually influence your stroke risk. If you want more science-backed health strategies explained clearly, go ahead and subscribe so you don't miss what's coming. Now, let's get into this. Let me tell you about Dr. Shigeaki Hinohara. He lived to 105, worked as a physician until he was 103, and became somewhat legendary in Japan not just for his longevity, but for his practical wisdom about staying healthy. Every single morning, without fail, he would spend exactly 15 seconds massaging specific points on his ears before he even got out of bed. Now, you might be thinking this sounds like folklore or ancient tradition without much substance. But here's where it gets interesting. Dr. Hinohara wasn't just following old customs. He understood something profound about how our nervous system works, something that Western medicine is only now beginning to fully appreciate. The story really begins with understanding what a stroke actually is. Imagine your brain as a city with millions of tiny roads, the blood vessels that deliver oxygen and nutrients to every neighborhood. A stroke happens when one of those roads gets blocked or bursts. When that happens, part of your brain stops getting what it needs, and brain cells start dying within minutes. It's one of the leading causes of death and disability worldwide, and your risk increases significantly after 60. But what does this have to do with your ears? Well, your ears contain something remarkable. They're mapped with dozens of nerve endings that connect directly to your vagus nerve, the longest nerve in your body. Think of the vagus nerve as a superhighway of communication between your brain and almost every major organ: your heart, your digestive system, your lungs, everything. Dr. Hinohara discovered what traditional Chinese medicine had known for thousands of years. When you stimulate certain points on your ears, you're essentially sending signals down that vagus nerve highway. And those signals have the power to calm your entire nervous system, lower your blood pressure, reduce inflammation, and regulate your heart rhythm. All of these are critical factors in stroke prevention. Let me paint you a clearer picture. Meet Robert, a 67-year-old retired accountant I learned about through a colleague. Robert had high blood pressure, was on medication, but still struggled with stress and anxiety about his health. His doctor warned him that his numbers put him at elevated stroke risk. Robert was frustrated because he felt like he was doing everything right, taking his pills, watching his diet, but his blood pressure would still spike during stressful moments. Then Robert learned about this ear massage technique. He was skeptical at first. How could rubbing your ears for 15 seconds possibly make a difference? But he figured it couldn't hurt to try. Every morning when his alarm went off, before checking his phone or worrying about his day, he would massage the specific points on his ears. Just 15 seconds. Within 3 weeks, something shifted. His morning blood pressure readings started coming down. Not dramatically, but consistently. More importantly, he noticed he felt calmer throughout the day. Those moments of anxiety that used to send his heart racing seemed less intense. His doctor was surprised at his next checkup. His blood pressure had improved enough to reduce one of his medications. Now, was it just the ear massage? Probably not entirely. But here's what matters. That simple morning ritual created a cascade effect. It activated his parasympathetic nervous system, the part responsible for rest and recovery. It reduced his cortisol levels, the stress hormone that contributes to inflammation and blood vessel damage. and it gave him a sense of control over his health, which reduced his anxiety, which further lowered his blood pressure. It was a positive spiral, all triggered by 15 seconds of intentional touch. The fascinating part is that this isn't magic or wishful thinking. When you massage your ears properly, you're engaging in what scientists call neuromodulation. You're literally changing the activity of your nervous system through physical stimulation, and that change ripples outward, affecting your cardiovascular system, your immune response, and yes, your stroke risk. Now let's talk about what's actually happening inside your body when you do this technique, because understanding the science makes it more powerful. Your vagus nerve is absolutely fascinating. It starts at the base of your brain and wanders. That's actually what vagus means in Latin. Wandering down through your neck, into your chest, and all the way to your abdomen. Along the way, it connects to your heart, lungs, digestive tract, and sends branches to nearly every major organ. It's essentially your body's built-in relaxation system. Here's what most people don't realize. About 80% of the vagus nerve's fibers are actually sensory, meaning they send information from your body up to your brain, not the other way around. So when you stimulate the vagus nerve through your ears, you're not just sending calm signals down to your organs. You're sending messages up to your brain that say, everything is safe, you can relax now, there's no threat. This is critical for stroke prevention because chronic stress is one of the biggest hidden risk factors. When you're constantly in fight or flight mode, your body releases stress hormones like cortisol and adrenaline. These hormones are meant to be temporary, to help you escape danger. But in modern life, many people live in a state of perpetual low-grade stress. Their bodies never fully relax. What does this do to your blood vessels? It keeps them constricted, tight, like garden hoses that are kinked. Your heart has to work harder to push blood through these narrowed pathways. Over time, this increased pressure damages the delicate lining of your arteries. That damage creates rough spots where cholesterol and other substances can stick, forming plaques. These plaques make your arteries even narrower and less flexible. Eventually, a piece of plaque can break off and block blood flow to your brain. That's an ischemic stroke, the most common type, or the constant high pressure can weaken a spot in an artery wall until it balloons out like an overfilled water balloon. If that weak spot bursts, you have a hemorrhagic stroke, where blood spills into your brain tissue. Both scenarios start with the same underlying problem: chronic activation of your stress response and the cardiovascular damage it causes over years and decades. Now, here's where the ear technique becomes genuinely protective. When you stimulate your vagus nerve, it triggers what's called the relaxation response. Your heart rate slows slightly, your blood vessels dilate and open up, your blood pressure naturally decreases, inflammation throughout your body reduces, because your immune system gets the signal that it can stand down from high alert. But there's another mechanism at work that's even more interesting. Your vagus nerve has a direct connection to your heart's electrical system. It helps regulate your heart rhythm, keeping it steady and coordinated. People with poor vagal tone, meaning weak vagus nerve activity, often have irregular heartbeats or atrial fibrillation. This is dangerous because when your heart doesn't beat in a smooth, coordinated way, blood can pool in the heart chambers and form clots. If one of those clots breaks free and travels to your brain, it causes a stroke. Studies have shown that people with higher vagal tone, stronger vagus nerve activity, have significantly lower rates of atrial fibrillation and cardiovascular events. They also tend to have better emotional regulation, lower anxiety, and more resilience to stress. All of these factors compound to create a protective effect against stroke. The beauty of the ear massage technique is that it's a direct, physical way to strengthen your vagal tone. You're training your nervous system to default to calm rather than stressed. You're creating a buffer against the daily pressures that would otherwise keep your body in that harmful state of tension. Think of it like this. Your nervous system has two settings, gas pedal and brake pedal. Most modern lifestyles keep your foot constantly on the gas. You're rushing, multitasking, worrying, responding to notifications, never fully at rest. Over decades, this wears down your cardiovascular system like a car engine running at high RPMs all the time. The ear massage is like remembering you have a brake pedal. It's a simple physical reminder that you can shift out of overdrive. And when you practice this daily, you're not just preventing stroke. You're fundamentally changing how your body responds to the world around you. Let me introduce you to another person whose story brings this all together. Her name is Margaret, a 72-year-old grandmother who had already experienced what doctors call a transient ischemic attack, or TIA. You might know it as a mini stroke. It was terrifying for her. One moment she was making dinner, the next her right arm went numb and she couldn't speak clearly. The symptoms only lasted about 10 minutes, but they left her shaken to her core. Her doctor explained that a TIA is like a warning shot. It means a clot temporarily blocked blood flow to part of her brain, then dissolved or moved on its own. But the warning was clear. She was at high risk for a full stroke. The statistics were sobering. After a TIA, about 1 in 3 people will have a major stroke within a year if they don't make changes. Margaret was already on blood thinners and cholesterol medication. She'd changed her diet, started walking daily, but she still felt anxious all the time, constantly monitoring her body for warning signs, afraid to be alone, worried that every little sensation meant another stroke was coming, and that anxiety itself was keeping her blood pressure elevated, creating the very conditions she was trying to avoid. A friend told her about the ear massage technique. Margaret was desperate enough to try anything. She learned the specific points to massage, the ones that correspond to vagus nerve stimulation. The tragus, that little flap of cartilage that covers your ear canal. The concha, the bowl-shaped depression in the center of your outer ear. And the earlobe itself, which connects to multiple nerve pathways. Every morning, Margaret would sit on the edge of her bed and spend 15 seconds gently but firmly massaging these areas on both ears. She'd use her thumb and index finger, applying pressure in small circles. She focused on making it a moment of intentional calm, breathing slowly while she did it. Here's what happened. At first, nothing dramatic, but after about a week, she noticed something subtle. That constant hum of anxiety in her chest, the feeling like something bad was always about to happen. It started to quiet down. She'd catch herself going hours without checking her pulse or worrying about symptoms. Her sleep improved because she wasn't waking up multiple times in panic. By the second month, her blood pressure readings were consistently better. Not just slightly better, but noticeably, measurably improved. Her doctor was pleased but also curious. What had changed? Margaret explained the ear massage, expecting skepticism. Instead, her doctor nodded and said that activating the vagus nerve through auricular therapy, the technical term, was actually gaining recognition in medical literature for cardiovascular benefits. But the most profound change for Margaret wasn't just physical, it was psychological. For the first time since her TIA, she felt like she had agency over her health. She wasn't just passively taking pills and hoping they worked. She was actively doing something every single day that made her feel calmer, more grounded, more in control. That shift in mindset reduced her stress, which reduced her inflammation, which protected her blood vessels, which lowered her stroke risk. Everything connected. Now, I want to be clear about something important. This ear massage technique is not a replacement for medical treatment. If you have high blood pressure, high cholesterol, diabetes, or other stroke risk factors, you absolutely need to work with your doctor and follow their recommendations. The ear massage is a complementary practice, something you do in addition to, not instead of, proven medical interventions. But what makes it so valuable is its accessibility. You don't need equipment. You don't need to travel anywhere or spend money. You just need 15 seconds and the knowledge of where to apply gentle pressure. And unlike medications, which can have side effects, or dietary changes, which require ongoing discipline, this technique has essentially no downside. The worst that can happen is nothing. The best that can happen is you activate your body's natural relaxation and healing systems in a way that compounds over time. Margaret is now 76. She hasn't had another TIA or stroke. She still does her ear massage every morning without fail. She says those 15 seconds have become her favorite part of the day, a moment of peace before the world rushes in, a small promise she keeps to herself that she's worth taking care of. So here's my challenge for you. Tomorrow morning, before you check your phone, before you start worrying about your day, give yourself 15 seconds. Find those points on your ears and massage them gently. Feel the connection between your fingers and your nervous system. Notice what happens in your body when you intentionally choose calm. Do this for 7 days and pay attention to how you feel. You might be surprised at what changes when you give your body permission to relax. If you try this, come back and let me know what you notice. I read every comment, and your experience might be exactly what someone else needs to hear. Take care of yourself. You're worth it.